Type 2 diabetes has been officially cured. Listen to this story. In November 2021, Barbara was out celebrating her 60th birthday when everything changed. In the middle of dinner, she began saying and doing things that didn't make any sense. She knew what she wanted to say, but the right words just didn't appear. Her friends, worried and confused, quickly rushed her to the hospital. Barbara had no history of heart disease, so this sudden episode was alarming. After hours of tests and anxiety, doctors revealed that she had suffered a mini stroke. The underlying cause? Chronic type 2 diabetes, a diagnosis that shook everyone. Diabetes, a word that many fear. It's a disease that once diagnosed cannot be reversed. At least, that's what science was a few decades ago. But how true is this? Can we actually reverse diabetes? If yes, why do people who are diagnosed with diabetes still believe there is no way out? Let's find out in today's video. But what is diabetes really? At its core, it is a condition that affects how your body turns food into energy. Normally, when you eat, your body breaks into sugar or glucose and releases it into your bloodstream. Your pancreas then produces a hormone called insulin, which helps the glucose get into your cells to be used for energy. So, in diabetes, the whole system goes mayhem. Either your body doesn't make enough insulin or can't use it as well as it should. This causes too much sugar to stay in your bloodstream, leading to significant health problems. There are a few types of diabetes, and understanding them can be a serious help. First up, we have the type 1 diabetes. This is an autoimmune condition where the body attacks the cells in the pancreas that make insulin. It's usually diagnosed in children and young adults, though it can appear at any age. People with type 1 diabetes need to take insulin every day to survive, because their bodies simply don't produce it. Then, we have the type 2 diabetes. This is the most common type and is usually linked to lifestyle factors like being overweight, inactive, or having a poor diet. In type 2 diabetes, the body doesn't use insulin properly. Initially, the pancreas makes extra insulin to make up for it, but over time it can't keep up. And the last one we have is the gestational diabetes. This type usually occurs during pregnancy and usually goes away after the baby is born. However, it increases the risk of developing type 2 diabetes later in both the mother and the child. The fear of diabetes mainly comes from its complications. High blood sugar levels over time can lead to serious issues like heart disease, kidney damage, vision problems, and nerve damage. Diabetes can be an insidious disease. You can be without symptoms for years and feel completely fine, but once complications start to take hold, it will make you feel worse than ever. The three most common complications involve damage to the nerves, the eyes, and the kidneys. Traditional diabetes treatment involves daily insulin, strict diet control, and constant monitoring of blood sugar levels. However, a breakthrough in medical science, cell regeneration therapy, offers a new way to tackle it. Diabetes involves the immune system mistakenly attacking and destroying insulin-producing beta cells in the pancreas. This autoimmune reaction results in the body's inability to regulate blood sugar levels effectively. Type 2 diabetes is typically characterized by insulin resistance. So advancements in cell regeneration have enhanced the functions and survival of those beta cells. So what is this insulin? It is a hormone produced by the beta cells in the pancreas and is crucial for regulating blood glucose levels. In type 1, these beta cells are destroyed, leading to an insulin deficiency. Type 2 diabetes involves insulin resistance and subsequent overwork, leading to eventual beta cell failure. In Mrs. Barbara's case, she felt her first symptoms around 2010 when she had a mild tingling feeling in the soles of her feet. It all started when she was in her 40s in the year 2006. Over time, this gradually worsened and became numb, which is a condition known as peripheral neuropathy, which results from damage to the nerves located outside of the brain and spinal cord. In addition to developing neuropathy and eye problems, she was hospitalized twice within 6 months in 2017 and 2018 for uncontrolled vomiting. According to the doctors, she had a condition known as gastroparesis, which is a condition that occurs when the enteric nervous system is damaged and fails to govern the functions of the gastrointestinal tract. Digestion slows down and food stays in your body longer than it should. Continuing back to where we left off, diabetes has long been a challenging condition to manage, affecting millions worldwide, and cell regeneration therapy has been studied for a very long time to tackle such diseases. So, cell regeneration therapy is a therapy that focuses on replenishing or repairing the damaged beta cells in your pancreas to restore insulin production. It has different scientific principles, and stem cell therapy is one of them. It uses the pluripotent stem cells, which have the potential to develop into various cell types, including the beta cells. Researchers have developed methods to guide these stem cells to mature into insulin-producing beta cells. Once they are implanted into a patient's pancreas, these cells can produce insulin in response to blood glucose levels, mimicking the function of natural beta cells. For type 1 diabetes, where the immune system attacks and destroys beta cells, this therapy can replace the lost cells. And for type 2 diabetes, regenerating healthy beta cells can improve insulin production and function. Certain drugs and molecules can stimulate the regeneration of beta cells from further damage. These regenerative medicines can be administered to patients to enhance their body's ability to repair and regenerate beta cells. Remember how Mrs. Barbara had neuropathy and eye problems? She thought that a little numbness wouldn't bother her. She ignored each and every symptom. Turns out she was suffering from type 2 diabetes. The danger of peripheral neuropathy is that you don't feel pain in your feet, so you may have an injury or infection and not realize it. The danger of peripheral neuropathy is that you don't feel pain in your feet, so you may have an injury or infection and not realize it. In addition to that, damage to blood vessels caused by high blood sugar slows blood flow to the feet, increasing the odds that small injuries will become infected and also slowing down wound healing. And damage to blood vessels caused by high blood sugar slows flow to the feet, which in turn increases the odds that the small injuries will become infected. She went to the local care centre, and with the look that the doctor gave her, she knew that something was definitely wrong. She was treated with strong antibiotics and told to see a podiatrist. Barbara jokingly mentioned that it's not like she's going to have her toe amputated, but what the doctor said shocked her. The doctor said that amputation could be possible. She had more wake-up calls since then. The first involved muscle loss. Her legs became weaker day by day. And that's when she had that mini-stroke. Turns out it was the combination of those. It never occurred to her that the problem could have anything to do with her diabetes. But after this, she found that there could be several other diabetes-related causes, including a decline in skeletal muscle mass known as diabetic myopathy. Another possible cause was peripheral artery disease, which is a circulatory problem. Making things worse was the fact that she was having her balancing problems, which was a result of the neuropathy in her feet. Oh, the biggest shock was still yet to come. When she was taken for the mini-stroke, she was given a diagnosis of acute kidney injury. After conducting several tests, she found out that she had chronic kidney disease, which is a complication that occurs when high blood sugar damages the tiny blood vessels that act as filters. And that was not even the worst news. She found that she had stage 4 kidney disease, with stage 5 being kidney failure. And as we all know, once the kidney fails, she would require either a kidney transplant or dialysis. Also, don't forget that diabetes is the leading cause of kidney failure. All she has now is a long list of prescribed medicines. She wishes that she had taken her diabetes seriously and taken control of her blood sugar sooner. That is where cell regeneration can make a rescue. It is being developed to cure such complications at an early stage. By harnessing the body's natural healing powers, this therapy aims to cure diabetes. The excitement around cell regeneration therapy has been building for years, but a significant milestone was achieved recently.
Our next report telling you more.
There just might be hope for those suffering from diabetes. In a significant medical milestone, Chinese scientists have successfully cured a patient's diabetes. How did they achieve this feat? Using a groundbreaking cell therapy.
The Food and Drug Administration has now approved cell regeneration therapy for diabetes. This approval is based on extensive clinical trials that demonstrated the therapy's safety and effectiveness. During these trials, patients who received the therapy showed significant improvements. Many were able to reduce or even eliminate their dependence on insulin injections.
A team from Shanghai Changjing Hospital, the Center for Excellence in Molecular Cell Science, and Renji Hospital have developed this treatment. All the details have been detailed in the journal Cell Discovery. The patient underwent the cell transplant in July 2021. Within 11 weeks, he no longer required external insulin.
The trials also showed that the new beta cells functioned well over extended periods, maintaining healthy blood sugar levels. The future of cell regeneration therapy for diabetes looks promising with ongoing advancements in biotechnology and medicine. Combining different approaches, such as integrating gene editing with stem cell therapy, might yield more robust and effective treatments. Personalized medicine, where treatments are tailored to the individual's genetic makeup and disease profile, also plays a crucial role in optimizing cell regeneration therapies. Moreover, this therapy significantly reduces the risk of complications associated with diabetes, such as heart disease, kidney failure, and nerve damage, all of which are similar to what Mrs. Barbara suffered. While the FDA approval is a huge leap forward, it's just the beginning. Cell generation therapy is revolutionizing the way we think about diabetes treatment. It stands as the beacon of hope for millions of people like Barbara. So one small step could make a huge difference. Rather than making things even more complicated, you should get an early checkup and take some measure of comfort in knowing what it feels like to finally take care of yourself. And if you enjoyed the video, please give it a thumbs up. Don't forget to subscribe to the channel and hit that bell icon so that you get notified of our latest videos.